Okay, that should have started. Okay, so first thing, it would be great if you could just give quick introduction of like who you are, your experience in speech therapy, and maybe your education prior to this.
All right, very good. Well, I'm Dr. Larry Barnes, speech language pathologist. I've been practicing in this discipline for 23 years now. I've worked in a variety of environments in hospital settings, skilled nursing facilities, 4 different school systems, residential treatment, and I've also worked for 11 years as a tenured professor in 2 different universities. So I really enjoy what I'm doing.
Wow, yeah, it's really awesome. What's your favorite part of working as a speech therapist?
Um, the most difficult part,
Or just the part you enjoy the most, I would say.
yeah. The thing I enjoy the most is seeing the progression of the people that I work with. They are, it's very noticeable how they become much better communicators. They're choosing their words with greater ease. They're saying their words with greater ease, and with that ease of communication comes a real sense of personal satisfaction for them, which translates into the satisfaction for me as a therapist. So it's very rewarding.
Yeah, yeah, that's awesome. It's a must be really nice to see that progress. Okay, so next off, just to get some like background information, what's the main role of a speech therapist or speech pathologist?
Well, speech language pathologists, we diagnose and treat a wide range of communication and swallowing disorders, and we do so with individuals of all ages across the lifespan. We also work with people who have difficulty producing sounds, understanding language, how to use their language to effectively communicate wants, needs, ideation, as well as swallowing safely. So SLPs often collaborate with other healthcare professionals and family members to ensure that the people that we are working with, whether they're students in schools or patients in hospitals, receive the absolute best care.
Okay, okay. So you would say there's a really wide range of not just disorders that you treat, but also like people as well.
That is correct, yes. So we work from infants all the way to geriatrics.
Okay. Yeah, really nice. Okay, next up, I'm just gonna ask you, what are like the most common types of speech disorders you deal with in your patients?
Yeah, so the most common speech impediments include stuttering and speech sound disorders. Stuttering is a fluency disorder characterized by repetitions and prolongations and blocks in speech. And speech sound disorders involves difficulties in actually forming specific sounds in the context of words and sentences and connected speech. Those are the most common issues that we deal with. And a close runner up to that are the various language disorders, just being able to understand, um, decode language, and then being able to not just process the language, but put it together in an expressive format that people can understand.
Okay, okay. In terms of like you talked about the stutters a lot. What are like different types of that specific disorder that you've seen?
The different types of disorders, is that what you're asking?
Yeah, like in terms of the stuttering people, like what are the most common symptoms you see is what I mean.
Um, the most common symptoms we see are, interestingly enough, individuals who start withdrawing. They realize that they are not communicating in a fluid manner, that it's not normal. There's a stigmatization that comes with that. And as a result, they start to withdraw. They don't like to participate in small group activities. They certainly find it uncomfortable to present in front of the classroom. In some cases, even with family members, we find that they will minimize their communication patterns. And so that's pretty serious. I mean, these are individuals who have wonderful thoughts and ideas in their brain, but they're electing not to communicate because they are stigmatized by the stuttering and they don't want to be judged for that.
Yeah, yeah, that's definitely a lot of stuff I dealt with myself. And I can say firsthand that like therapy and intervention is so really useful in that sense.
Yes.
So, yeah. Next up, this is something I'm also really curious about, but what causes speech disorders? Is it like, genetic or is it environmental or like what's the root cause of most disorders you see?
Well, communication disorders can arise from a variety of factors, broadly categorized as biological and environmental. So the biological factors include genetic as well as neurological conditions resulting from traumatic brain injury, stroke, neurological disease. And then the environmental factors, we have children who are deprived of the opportunity to learn language in their environment. The language exposure is often very limited. So these factors can affect a person's ability to understand and produce language. It impacts articulation, impacts their overall communication ability.
Yeah, yeah, I can definitely see that. Um, so yeah, this is a bit of a follow-up of the last one, but in terms of like the initial assessment of a patient, what does that look like in a speech therapy setting?
Yeah, so an initial assessment for any communication disorder involves gathering information through various methods and from a variety of sources. And our goal is to identify potential issues and establish a baseline, what the individual can do well, what they struggle with, and that helps us in further evaluation and choosing treatment targets. The process typically includes reviewing an individual's case history, observing their communication in very naturalistic settings, and using both standardized as well as informal assessment tools. We bring all that together, that data, and then we analyze it. I look for paradigms, different patterns within the data that helps me best understand what exactly is happening, and to the best of our ability, what is the cause of that. Knowing the etiology of a disorder helps us to target it more effectively in treatment.
Yeah, yeah, it's definitely really fascinating stuff. Is there something you do to like track the progress of a patient specifically?
Yes, absolutely. So every therapy session becomes an assessment of that individual. We're constantly gathering data on performance and what is working, what isn't working, why it's working, why it isn't working. Everybody learns and processes language differently. I use a variety of multi sensory input in my therapy. It's visual, it's auditory, it's tactile, it's kinesthetic. At times, I've even used olfactory, sensory of smell integration in therapy. So we gather the data, we find out what works really well with that student, and once we discover what works best, we stick with it and make that the emphasis of our therapy approach.
Wow, yeah. That's this it's really awesome. Yeah, just the entire process. Um, Next up, I was doing research on more speech therapy and I came across the term early intervention. Could you tell me more about like what early intervention is and how it looks in a child's life or a patient's life?
Um, so I think sometimes that when it comes to any kind of therapy, but especially speech therapy, there are certainly some myths and misconceptions about it all. One common myth is that children will just simply grow out of their speech or language delay. In some cases, that does happen. In many cases, it doesn't. And waiting can actually delay crucial intervention. And so it's important that we intervene early as possible. I think another misconception in speech therapy is that it's really only for stuttering, people who stutter or who have articulation issues. They're not intelligible. In reality, it addresses such a wide range of communication challenges, including voice disorders, swallowing disorders, and even cognitive communication, thinking about the language we use, thinking about the way we think about our environment and our language. Um, I think another misconception is that there are fixes to communication, to the communication system. Often the cause is neurological, and while therapy can strengthen neurology, what it can't do is fix the neuropathology, if that makes sense.
Yeah, yeah. So you would say all this like therapy, all the strategies that you tell your patients, it's more to deal with the disorder, not to cure it, right?
Yeah, so really what I'm doing is I'm giving people the tools to use in order to minimize the negative outcome of their communication disorder.
Mhm.
So the more they use the tools, the better they communicate. In some cases, like stuttering, for example, what's interesting about that is that some people will go for a lengthy period of time stuttering and then it'll stop and then it'll pick back up again at a later point. It kind of waxes and wanes.
Mhm.
There's a significant percentage of school age children who never stutter again. Now, that doesn't mean that their neurological wiring has somehow been repaired, so to speak. But what it does mean is factors were playing such a role in their brain development. Because keep in mind, the brain is developing significantly up to the point of age 25, that they were able to compensate for those deficits and learn how to communicate more effectively. And as a result, sometimes their stutter never comes back again. So, that's a good example of how varied disorders can be and how varied the impact is on the individual.
Yeah, yeah, that makes a lot of sense. There's one like misconception I heard a lot from my parents and friends when I was really struggling to speak when I was younger, and it's that like my speaking problems was because of my nervousness or low confidence. Is there some degree of truth to that, or is it mainly just a misconception from other people?
Well, there's a real psychological component to what we do. And the psychology involves learning to be comfortable in your own skin. And that presents as a different challenge for different people. And part of my role, I try to incorporate it into the therapy lessons for every student that I deal with, whether it's stuttering, whether it's articulation, whether it's language, whether it's pragmatics or voice, whatever it is help them learn to become more comfortable with who they are. And I don't care who you are as a human being. There's always going to be people out there who judge us by our look, by our sound, by our behavior, by our attitude, etc. That's just normal within society, within human interaction. It's important that we get to a point where, yeah, we want to behave properly. We want to communicate to the best of our ability, but we all make mistakes. My daughter is hearing impaired, and she told me one day, she said, Dad, my ears are broke, but everybody's got something broke with them. I, wow, that makes perfect sense. So why not just get to a point psychologically with being comfortable with who we are? That doesn't mean we're not working on getting better, but what it does mean is we're shutting out the judgments, which help reduce the anxiety, reduce the nervousness. And the more we learn to accept ourselves, the easier it is for others to accept us for who we are.
Yeah, yeah, that's really awesome. I know personally all of my speaking like issues translated to, like you said, like social anxiety, but also really low self-esteem, low self-confidence. And I really think knowing that your speech disorder does not define who you are, it's how you deal with it. And there's other stuff about you and other stuff about other people that you should take into consideration. That's a really good perspective. And it's something that I really want to live on.
Yes. You know, there's a great TED Talk video out there given by Meg Washington. I believe that's her name. I think she's an Australian professional singer. So, one of the interesting things about stuttering is that you don't ever stutter when you're singing.
Yeah, yeah.
So she is a stutterer and she's a professional singer. Mel Tillis was a stutterer, a person who stutters and a professional singer. So she gave a TED talk about that in front of thousands of people. And throughout the course of her presentation, there were repetitions, there were prolongations, and there were blocks that were occurring. And in it all, she was just honest with the audience and said, "Hey, you know what? This is who I am. And I'm okay with it. So I want you to be okay with it too."
Yeah, that's really awesome. Could you tell me the name of her TED Talk again? I want to watch it after this is over.
Yeah, it's on a TED Talk, and the video is by Megan Washington. And what is the title of that? I think it's titled, um, oh gosh,
I think with the name, I can probably
I think with
find
the
it.
author, you should be able to
Yeah,
find it.
yeah,
If not, holler back at me and I'll look it up. I look at it so frequently, and I've used it many times in my therapy sessions that when I just bring up a few of the characters, it automatically tags to it. So
yeah, yeah. That's a really awesome story. But with that being said, there's one question that ties into, parents and teachers, and it's what are like the specific signs parents or teachers should watch out for in children that may indicate a speaking disorder?
yeah, well, the key signs include obviously difficulty producing speech sounds, difficulty understanding language. So you have to repeat your instruction multiple times, usually through auditory instruction alone. It's not good enough. Oftentimes it has to be in written format as well. So there's a breakdown in that understanding of language. Um, we have kids like one that I'm working with right now. The teacher said after he speaks for a few sentences or two, he realized he's struggling so hard to find the right words, he just gives up on it. And so that lack of engagement, that social withdrawal is a key sign. I ask teachers to please look for that. If you see kids withdrawing, they don't want to engage, and you notice that they are struggling with their communication abilities, please reach out to me right away because that early intervention is so key and essential in helping them overcome that.
Yeah, that's definitely really important. I know for myself in elementary school, I wasn't referred to therapy until like fourth or fifth grade. And the reason was not because I could speak fluently. The reason was I just refused to speak at all in class, and no one really knew that I had trouble speaking, and teachers never caught that. So it's definitely really important to, drive down and really understand these signals early on.
You know, on that note, I encourage teachers to not address the difficulty in front of everybody.
Mhm.
Let the individual work through the issue and give everybody in the classroom ample time. We're not in a hurry. So take as much time as you need to communicate your thoughts and ideas. Don't worry about being corrected in front of any of people because that can be very embarrassing. just be patient, understanding, and do away with any of the judgment that sometimes creeps in.
Yeah, yeah, definitely. I know a lot of times in class I would try and say something and the teacher would interrupt me and finish my sentence. And it was like really demoralizing and I just never learned anything from that, you know. So yeah, it's really important, I think, for teachers to know a lot of these signs early on so they can avoid doing stuff like that.
Right, exactly.
Yeah. So to continue on, my next question is more about your therapy sessions personally. And it's what kinds of tools or strategies do you use in therapy sessions, and how do you adapt those for different speech disorders or different age groups or like types of activities in general?
Well, the first thing that I want to share with you is that therapy is not teaching. I'm not a teacher, I'm a therapist, and there's a very distinct difference between the two. So, therapy is very intensive, very repetitive, and it's very meta analytical. What I mean by that is thinking about your communication patterns, thinking about what you're saying, how it's coming across, thinking about decoding the language and learning how to decode it. So that's what therapy is. A lot of it incorporates exercising the brain in ways that capitalize on neuroplasticity. So, neuroplasticity is that ability of the developing brain to grow new neurons, prune old neurons that aren't working well. And if we catch the individual early in life, then we catch them at that moment where their neuroplasticity is at its greatest. It's in a heightened state, and that's going to maximize that child's communication potential in a therapy setting. I liken it like this. Here's my analogy. Teachers fill the box with knowledge. I build the box to receive the knowledge.
Yeah, yeah, that's a really good quote. I'm definitely gonna think about that later. But yeah, so you would say it's really important for people to know the difference between teachers and therapists because it's a completely different job. And often, especially with speech therapy, what I've seen is they get grouped together and it's a lot less productive.
It is very different, and there's a general misunderstanding of what therapy is about. I've had a few teachers, and certainly have had parents at times attend my therapy sessions, and when they see what I'm doing, their response is, "Wow, I didn't know that's what you guys did. That's pretty impressive. That's awesome." Um, if it was nothing more than teaching, it wouldn't require a master's degree in our profession to do it.
Yeah, yeah, definitely. Okay. So with that being said, this is more of, you know, a future perspective question because I often think about the collaboration with speech therapy and new technologies. But in your opinion, what do you think the implementation of AI, artificial intelligence, in speech therapy could look like in the future?
Well, here's my personal take on AI, and I do use it. AI is very helpful for me in differential diagnosing. So early on, I said when I evaluate and I gather all this data, excuse me, I look for patterns, paradigms, right? The helpful thing about AI is it could help me think about the patterns I'm looking at and help me differentially diagnose. Well, this probably isn't autism. It's probably more of a pragmatic language disorder. Or this isn't this disorder. It lends itself more to this disorder. So there's a differential diagnosis, which helps me to be more accurate in my treatment. AI is very helpful with report writing. I use AI to help generate cohesive paragraphs that are intelligent, that are smart, that hone in and say exactly what I need it to say based on the data that I'm gathering. gathered, and AI also will help me in developing a treatment approach. What's the best approach to help this individual remediate some of the deficits that you're seeing? The one thing that I will say is AI will never play an effective role in therapy implementation. And the reason why I say that is human interaction is what communication's all about.
Mhm.
And if you remove the human equation, all you have is robotic, conditioned responses to environment. That's no longer human communication.
Yeah, definitely. I think one of the main parts about therapy is that personal connection, actually talking to a human and knowing you're speaking to someone that understands what you're going through instead of just text on a screen or some generated voice. That's definitely a really good insight.
Right. The human connection. It's like what you and I have right now, right? I mean, you're reading my facial expressions, my body language, my gestures, my tone of voice. So words in and of themselves communicate only 30% of the message. The other 70% of the message is what we call metalinguistic or paralinguistic. It's beyond the words. AI can't give that to you. You
Yeah,
lose all that.
yeah,
And so to think that somehow artificial intelligence can step in and help remediate a communication disorder is just unthinkable from my perspective. Now, I do know that there are therapy groups out there that are using it as a therapeutic approach, but I'll be frank, I just don't see that to be efficacious at all.
yeah, definitely. So, with that being said, there's one follow-up question to that. And I just want to ask, in your opinion, what are the biggest barriers to people receiving speech therapy that you've seen?
Yeah, I would say, well, let me think this through. Obviously, the financial situation can be a barrier. I don't find that to be often the case because there are so many resources out there, but financial constraints can play a role. I think a lack of qualified professionals. So I don't know if you're aware, but there's a plethora of job openings in my discipline. We just can't get enough speech language pathology graduates um, out there to fill all the positions. So that's definitely a barrier. And then there are cultural linguistic differences. So, for example, some cultures don't believe in looking to therapy for assistance. Um, and then other cultures, the linguistic differences would be um, they they are afraid that we're going to try to cookie cut their student to be more Americanized. And so the cultural linguistic differences aren't preserved. I do just the opposite. I want your son and daughter to communicate as effectively as they can with all of the wonderful differences that make them a unique communicator. So some of those misunderstandings can be a barrier. Geographical limitations. So we have a lot of rural areas outside of the suburban areas that simply don't have access to speech therapy, and that can restrict access to the special care that people need. I think, in addition, navigating the healthcare system, understanding insurance coverage, finding transportation can also pose a challenge. Here's something I do want to bring up because this is something a barrier that I've been experiencing lately. If parents do not feel they are getting the assistance they need when they need it, then they need to speak to the professionals within
Within
the
this,
system, within the system that they are seeking help from. Bringing outsiders to tell those within the system what and how to do it, that's divisive and it breeds resentment. And nothing good can come out of that. It's not in the best interest of the student. And unfortunately, there are people making money supposedly advocating for the needs of children. But what they're really doing is they're creating barriers to treatment access. And so I really want to encourage parents, if you're concerned about the quality of therapy that your student is receiving in the school system, or even in a hospital setting or whatever setting your loved one is in, speak directly to those professionals and work with them in altering the quality of care that's given. Bringing outsiders in, that creates some real problems.
Yeah, it's definitely a really, really big thing. I know personally for me, my parents had very little trust in the therapy system, especially in like elementary and middle school. And I feel like that also ties into the stigma that you were talking about, especially cultural. Like in my culture, therapy is usually frowned upon. And even though it was so, so essential for me to progress, if my parents never truly realized the importance of therapy and let all of those cultural beliefs come in, then I would not have been the person I am today. That's definitely really, really important.
Yeah, very good. And that's a wonderful testimony that you have. I am so glad to see how much you have progressed and what an incredible communicator you are. You've got a lot to be proud of, and I know your parents are proud of you.
Thank you. Thank you. That really means a lot. So yeah, that was my last question.
Okay.
And yeah, it's just really, really fascinating to me, your entire field, how professional yet how well you approach patients. I know firsthand because you were my therapist, right? And it really changes so much to have someone that understands truly what you go through every single day, that won't judge you for how you speak, that won't define you for what you are, and truly just helps you progress and progress. And yeah, that really means a lot. I just want to thank you again for all the help and also this great interview. You have so many good insights. And yeah, do you have anything you want to add?
Well, it's been my pleasure and it's been an honor. It really has. And the relationship that you and I have built will last forever. I'm always going to be accessible to you. You know how to reach me, how to get in touch with me. And I'm always happy there to support and listen and be a part of your life as much as you want me to be. So thank you for that honor.
Thank you. Thank you so much. It really means a lot. So yeah, with that being said, there's 1 minute left on the meeting, so perfect timing. Once
Perfect
again,
timing.
yeah, thank you so, so much. It's been really an honor for me. It's been so useful.
Well, you're welcome. Stay in touch. And again, let me know if there's anything more I can do. All right, buddy?
Yes, 100%. Thank you so much, Dr. Barnes.
All right. Have a good rest of your year. Good
You
school
too.
year.
Thank you.
Bye.
Bye bye.